Welcome back, guys. Today we are looking all at lower back pain and specifically disc pain. So 1 in 4 people every month experience lower back pain. Back pain, by the end of our lives, 80% of us actually experience it. The onset of back pain, general ages are between 20 and 40 is when it starts, but you generally see it progress between 40 and 80. So the older you get, the more degeneration you get, and that causes more of that lower back pain. When we talk about lower back pain, there's 3 different types of lower back pain. So the acute lower back pain you might be familiar with, and this is often where you really struggle to get out of bed or go from sitting to standing. It's very sharp, excruciating pain. This pain lasts for 6 weeks. So 0 to 6 weeks. Then you've got subacute, which is 6 weeks to 12 weeks. And then we've got chronic. So chronic is what a lot of us deal with, and the older we get, generally it will start to go a little bit more chronic. Chronic is generally over 12 weeks. You've got 3 main causes of lower back pain as well. So the number one, and this accounts for 97% of lower back pain, is mechanical. So this is things as the disc, facet joints, other mechanical things in the spine that may be out of alignment. So you've got systemic, which accounts for 1%, and you've also got referred pain, which accounts for 2%. So as you can see, the most of it comes from that mechanical pain, which is what we're going to be looking at today. What is a lower back disc or a bulging disc, or all these things you may hear and you might be a little bit confused at? So as you can see here, this is our lumbar spine. There are 5 vertebrae in our lumbar spine, 1, 2, 3, 4, 5, or 1 to 5. And then this all sits on the sacrum at the bottom here. As you can see, between each vertebral body, so these bony parts are the vertebral bodies. Between them, you've got a cushioning, so the intervertebral disc. Now the discs are made up of a strong sort of fibrousy outside, which is called the annulus. And then the nucleus pulposus, which is on the inside, and it's like a gel material. Discs act as shock absorbers. So with movement, impact, a lot of sporting activity, or even just in the garden, these discs absorb a lot of it. And what happens over time is we start to degenerate through these. So we get wear and tear. It's like a car. The older a car gets wear and tear. We get the same thing. A lot of the time, this outside, it's a fibrous little outside, the annulus can start to weaken. And what else can happen is if you've got bad posture, if you've got immobile segments, so areas of the spine that don't move very well, this can start to put pressure on one area of the disc. And as you can see here, when the annulus weakens enough and there's enough load on top, you get a little outpouching, which is called the bulge. And as you can see, most of the time, this bulge will go out to where this yellow part, the exiting nerve root is. And if this compromises the pathway of the exiting nerve root, or even the inflammation can sensitize the nerve, this causes pain. So the pain can be local, or it can go down the back of the legs and can be that referred pain that you may be familiar with. It generally can take 6 to 8 weeks minimum to start to regress or take pressure off this exiting nerve root. But then it's really important to, number one, mobilize the spine above it and the pelvis and whatever may be immobile underneath it. And then also to strengthen around it. So a big one you may have heard of is the transverse abdominis. It's a core muscle that kind of runs in front and keeps the spine nice and strong. So we want a lot of stability. We want mobility around it because a lot of the time we rely on our lower backs a little too much. So for those with an acute lower back, so what we're focusing on here is just 2 basic things. You don't want to be pushing it, you don't want to be doing too many exercises, you really just want to let it settle. You might want someone to help you lift your legs here, so you slowly can pivot, or if you're on a bed, you can get cushions, bolsters, whatever it is, just to lift things up. And by doing this, it takes pressure out of that lower back. If you're laying flat on your back, it can be a little bit of pressure through there. And if you've got an acute lower back, you're gonna go to stand, it's gonna be a lot more painful. So we wanna make sure that we take the least amount of pressure through the lower back, especially if it's a disc, and we let things settle, especially over these first 3 days. So with this one here, I like to do two things while we're in it. So number one, if it's not too painful, to get a heat pack. And then number two, this is the big one. So you're gonna go with your index finger and your thumb, we're gonna go around your abdomen. As we get it around here, what we're gonna do is a deep breath in through the nose. Feeling the belly with the breath. And then as you breathe out through the mouth, you're really trying to focus on all those muscles around the lower back, and we're going to try and get them to switch off and relax as much as possible. So remember, it shouldn't be too painful. If you're doing a deep breath in and you're feeling those lung fields too much and putting too much pressure through the abdomen, if it's an irritated disc, it might cause pain. So you want to monitor. As long as we're not feeling pain, it's doing you good. If you're feeling pain, you're stimulating all that inflammation, the sympathetic system to come back on and really guard things. So deep breath in, feel the belly as much as possible, feel that pressure increase, breathe out through your mouth. Try and really focus on all those lower back muscles and get it to go nice and light, everything deactivated. And after 4 or 5 reps, you should start to feel a little lighter through the lower back here. Okay, so this is a really good one, guys. Like I said, the heat's a great one. The breathing technique can help release it. I will say though, if your back is very acute, you can get it to alleviate a little bit in this position. But a lot of the time, as soon as you go to move it again, there's going to be sharp pain, that whole nervous system flare-up's going to happen and you will be struggling. So just know that when your back is acute, it is very hard to let it settle, and sometimes it's more so finding a position to be in your most comfortable state, because the first 3 to 5 days, you're going to feel a lot of pain. After that, it should start to alleviate, and that's when we can start to do more of the exercises and really start to get things moving above, below, and stability stuff around the lower back. Okay, so number 2, what we're looking at here is nice and simple heat. So a lot of people will say ice or an ice bath mat might sort of help flush some of that inflammation in and around that exiting nerve root and take some symptoms away. Yeah, I do agree. The ice bath can help, but generally when you're in a very acute stage and you're in a lot of pain, the heat's going to promote what we call our parasympathetic nervous system. So the rest and digest, the nervous systems that let the muscles relax a little bit more. So we're gonna, if we're in this recovery position, we've got the heat on it, we're using the breath, that's gonna hopefully let things and the spasm muscles release a little bit, which is a lot of that pain you feel, it might subside. A lot of the time it doesn't though, so just know that for the first 3 days, you've just sometimes got to let things settle and know that as soon as you move, it's expected that there's going to be a lot of pain. Okay guys, so these are my 4 favorite exercises for someone with a lower back disc pathology. My number 1 exercise I like to do is segmental cat-camels. Now you've probably heard of cat-cows, cat-camels. A lot of the time you're just lifting from the mid-back, so it's a lot of people just teach you to lift through the mid-back, drop down through the mid-back. What I want to see, and the best thing to do, is to focus on trying to move each individual segment of the spine. So it's a little bit more complex than what you may have seen before. You're going to start by pushing those hands away into the ground. So pushing into the ground away from you. The movement here is going to initiate through the pelvis. So you're going to tuck that tailbone under, as long as this doesn't cause pain. And then through the lower back, you're going to try and close your eyes, focus on one little segment at a time, lifting up towards the ceiling. So as you can see here, I'm going through my mid-back, I'm going through my upper, and then into my cervicals, into my neck, tucking the chin all the way into the chest. Now what happens when we get to this position? We go back to the tailbone, keep that neck tucked, and we're going to untuck that tailbone. So extend the tailbone and then start to extend through the lower back, through the mid back as we breathe out through the mouth. and then finally finishing up in the cervicals. So once again, what do? We start to push into the ground, we tuck our tailbone, keep the neck extended until we get up to it. Systematically go through one little vertebrae at a time, breathing out, still pushing into the ground, tucking the neck. Then with the extension here, squeezing the arms into the ground towards your knees now to help extend better. And it's just one little segment at a time, locking those shoulder blades down and back, up from here. So these ones here, guys, they're amazing to do. I always like people to go through 2 lots of 10 with them. So remember, guys, if it is a disc injury and the flexion phase of this is hurting, don't push through. So you need to wait until you're at a solid level with this. A lot of the time, I'll get my patients in here. So a lot of the time in here, I'll get my patients just lifting to right before the point they'll start to feel the pain. So we don't want to be sort of lifting aggressively and being like, oh, this hurts, but I'll push through and hopefully it'll get better. It won't, it's gonna hurt a lot more later on. So you just want to be tucking the tailbone, lifting to the point of that barrier, really listen to your body, and then you've got to play within your range of motion in the zones that don't hurt you too much. All right, guys, so number 2, I want to do a little stretch for the hip stabilizers here. So a lot of the time we get really tight in the side here, which will sort of contribute to the tightening of the lower back. So what we want to do here, there's a few different methods we can do and levels we can do. So you're going to be laying on your back, hooking the ankle over the opposite knee, pushing that knee away. So this is pretty much number 1, the easiest way to do it. Number 2 is then hooking the hands under the knee and pulling this into our chest. So right here, this is, you should feel a solid stretch through the side here, shouldn't be any pain in your lower back. And you're trying to use your breath here, so in through your nose, and as you breathe out through your mouth, relax everything in the side of the hip, but also try and pull that ankle a little closer towards your chest. And you can do this, guys, for 30 to 40 seconds each side. Twice through if you want. So with this one, there's a few different things we can do. So to start off with here, the easiest one, step number 1, is just to be slowly dropping the feet down to the ground up from there. Now, as we drop, there's a few things I want you to focus on. Number 1 is locking the ribs down and under. Number 2, pulling the navel down towards the floor. Number 3, locking that lower back into the ground. So before you even drop, I want you to try and hold that. So with the arms over the head once again, and then dropping with that leg, making sure none of this changes. And it is actually, if you try and keep it all tucked in, it'll be pretty hard. If you start to go down here and you get to here and you're like, oh, I can feel a little bit of pain in my lower back, we shouldn't be doing this one yet. Or what you can do is decrease the motion. So if you are feeling pain as you get to the bottom, we can just go a little less. So just to there, and keeping everything locked still. So you can alternate sides on each one. But with this one, we want to get to the point where you're keeping everything locked in and dropping everything down to the ground there. So all we're doing here is laying on our belly, wedging those elbows under the body here, and then from here we can slowly just press into it, walk the elbows out, keep the shoulders nice and low, and hold this. We call this the Mackenzie maneuver, or Mackenzie position. And what this is doing is trying to put pressure on the opposite end of the disc. This position puts pressure on the opposite end of the disc and hopefully gives the bad or sore area where that exiting nerve root is. It'll give it a little bit of room to breathe and hopefully encourage the disc to regress a little bit. So this one here, I like my patients to sort of hold, lay in it from 3 to 5 minutes, and then you sort of slowly go back down and have a little rest for a second. You can place your head on the ground if you want, And then after 30 seconds of rest, you slowly, remember it's always slowly, walk your way back up. Now, elbows is the start here. A lot of people will get to the stage where their disc injury will start to improve. And then from here, they can use their arms to start to extend up onto it even more. So remember, you can start just with a little bit of lift with the elbows and then progressing to a little bit more through the arms. But as long as there's no pain, as long as you don't feel any of those symptoms. For those who may have progressed past this stage, I do have some other really great videos of lower back mobility, core strengthening, all those things that will help with you. Remember, my golden rule is if there's pain, stop straight away. So your body's smart, it'll let you know what doesn't work for it. And if you do feel pain, don't push through, don't try and make it work. It's not going to do any good for the body. Also remember guys, not everyone's lower back pain is the same, or if those with a bulge, it can be very different from patient to patient. So I really do highly recommend you go and see an expert before you try any of these. And make sure you get proper guidance there. So if you did try these guys and you really liked them, let us know the ones you enjoyed. Let us know how you're progressing on and what other things you might like to see me post here. But until next time guys, take care, and I hope those lower backs stay nice and healthy. Cheers guys, catch ya.